the lateral position. This is also sometimes referred to as either right or left lateral recumbent. So if you hear that term, it's also talking about this position. Now, the word lateral means to the side of. So this position either deals with being on the left side or the right side. So with this position, we want to put a person in a lateral position if they are having a seizure, or if they're unconscious, or they've had some type of surgery where they're going to be having a lot of drainage, for instance, like throat surgery, because we want to prevent them from aspirating. So this position can help with that. In addition, it can help with keeping that airway open, which is really important on that unconscious patient and the patient who's having a seizure. In addition, it can be used during surgery of the hip and the kidneys. Problems with this position arise from pressure injuries. So because we're on our side, think of those bony prominences that hang out on our lateral side. So we have ears that could be affected, the shoulder, the elbow, the hip, the knees, the ankle, and because we have those nerves up there in the shoulder, we could damage the brachial plexus. Okay, so that wraps up this video, and don't forget to check out the other videos in this series.